Good morning. We are the team that has been working with the diabetes challenge with Openlab. You're from Openlab. And my name is Phyllis Kiragu. I have a background in computer science and artificial intelligence. I come from Nairobi, Kenya.
Good morning. My name is Daniel Kurui from Kenya. I have a background in computer science, specializing in data science and machine learning.
My name is... Yes? Okay, my name is Lisa and I'm from Gothenburg in Sweden. I'm currently doing my master's in human geography and I have a background in urban development.
And I'm Anna Shori. I have a background in photography and filmmaking, and I'm currently working as a communicator and project manager here in Sweden.
Okay, hi, I'm Zalsaya from Mongolia, and I'm doing the Innovative Governance program at the KTH.
And I'm Tommy from Finland, and I'm studying in the same program as Zalsaya. When we started our project, none of us with any experience from medical field or diabetes, we met a guy. And he was doing quite well with his diabetes, but sometimes it is a struggle. For example, he told us that even a simple thing like banana can cause his blood sugar to skyrocket. So he has to use, even when choosing a snack, advanced mathematical skills. And when he has eaten half of the banana, which is the most he can eat at once, he's faced with another challenge: what to do with the other half of the banana. So Phyllis is going to continue and tell what this means in the bigger picture.
Okay, so Södertälje Hospital, that is represented here today, came to us with a challenge, and their challenge was that they were having a very low quality indicator with an indicator called HbA1c, which is basically just what is used to measure patients' blood sugar in the long term. And this was having an effect on both the patient and the hospital. With the hospital, they are fined when this indicator doesn't get to the recommended point, and they are fined through cuts in funding, which affects everything because the same funding is what they fund emergency visits and appointments. The other thing, and the most important, is the patient. The patients have low blood sugar, which means that they have a bad quality of life, and also they suffer every day. Sometimes they have to end up in emergency care, even ICU. So we need to help this patient learn how to take better care of themselves and improve their quality of life, in that now they won't have more emergency visits, they reduce appointments, and their life in general will be better. So to achieve this, we went through a process of interviewing. We visited Södertälje Hospital. We talked to many patients. We talked to relatives and friends of patients because we wanted to get one goal. What is it like to live with diabetes? Because none of us is from a medical field and we have no experience with this at all. So we needed to understand, what does it feel like? So we got some insights, as you can see, and there were things that were coming out. One of them was that human support is very important. You need that support. You need something that gets you going, but also personal support, like personal motivation. What motivates you to wake up every day? What motivates you to take a walk instead of taking the bus? What motivates you to change your lifestyle? And we needed that from a personal level. So we also needed like personal tools, information from different languages, because even in Sweden alone, there are very many people who don't speak Swedish or English. And with that in mind, we redefined the challenge, and now we came up with this. A diabetic has to be his or her own doctor, because they get 2 appointments a year in the hospital, which means they have the rest of the time on their own. They need to take care of themselves. So we were thinking, what should we give them to help them do that? And we came up with a personalized and customized toolkit that will help them get a better start with their life with diabetes. And Lisa is going to give us some solutions that we came up with.
Yes, so when we started coming up with our possible solutions, we wanted to communicate and create a feeling of motivation. And we then came up with a diamond symbol that we have worked with during the rest of the process that symbolizes how people could feel with the help of our solutions. And our solutions were really wide-ranged, where some could have an effect on a national level, one or more local, or specific to one patient. And the AI nurse, the first solution we came up with was an app that you could call 24/7 and ask to get advice, like what do I do if my blood sugar meter looks like this, or anything else. And the diabetes nurse at Södertälje sjukhus told us that she can't really go home and check up on all her patients all the time, so this would be a solution for that. And the Diamond Center we came up with to meet the need for human support, and it would be a place where people with diabetes could come and meet other people with diabetes and meet with nurses, get advice, or just hang around. And it would also have a cafe with healthy and good food and fika, of course. And the sticker campaign is about food labeling, and we had some different ideas of labeling food to make it easier to find recommended foods in the supermarkets. It could either be a label directed towards diabetics only, or a more broad label showing low sugar and low carbohydrates, which we also learned that people without diabetes would be interested in. And the last one was this starter kit that would be a gift that patients receive from their diabetes nurse with helpful tools to make it easier to take better care of themselves. And this would be a really inspirational and motivational kit for the patients. And Tommy will now explain about our decision process a bit more.
Thank you. So when we first presented the 4 solution to the public here, we received very positive feedback from our challenge givers. This was very nice, but didn't help us to choose the one solution that we would like to develop further. So we needed to use multiple methods to evaluate the concepts and eliminate the weaker ones. We used decision matrices, we did more interviews, we did more research, and we even tried sketching. For example, when we used the decision matrix for the first time, in which we gave different aspects of all solutions points, we realized that the AI nurse has some ethical issues pertaining to it, and also it's very, very technical to develop, so we eliminated that. When we were doing interviews, we learned that the diabetic and the National Association for the Diabetic People think that there are already too many food labels in the products, and one for just the diabetic would be stigmatizing, or could be stigmatizing. Between the Diamond Center and the kit, it was a bit more difficult to choose, but we finally reached a solution or decision that the kit would have more potential in the development. And also it would take our project closer to the patient, which is the most important part of the thing. And Daniel is going to continue with the details of the solution.
Thank you, Tommy. So the starter kit, that is our solution. So we brainstormed on what idea or what we can have in this starter kit, and these are some of the ideas that we came up with. So the first item is the basics. Any diabetic patient must have this. So we had an idea of having the meters and the insulin pumps. These are the items which are normal diabetic normally use. We also wanted to give information to a diabetic because they have to understand their disease. So they must have a lot of information about the disease so that they can be able to take care of themselves. And we had an idea of having the information translated in the language they can understand. We understand that Södertälje is composed of diverse people coming from different backgrounds, different countries. So having this information in their language could be very important. We also thought of food, which is something very crucial to a diabetic. So we wanted to give recipes from different cultures, different countries, in different languages also. Another idea is to have the snack or beverage in the kit. This will give a clue to these patients on what kind of a snack or what kind of a beverage they can have. because most of them actually just use water only, so maybe that can give them an idea. We also thought of theming these kits. We know different people do different things. There are people who are sporty, there are people who are who normally work a lot, there are people who travel. So we thought of having a kit for each personality. For example, a person who travels a lot. So his kit or her kit will have something like a Frio to keep his or her insulin refrigerated or cool. Then another idea we had is when to give this kit to this patient. Is it at the beginning or when the patient is diagnosed, or will it be something which they will be getting, or is something which is frequent, or based on some kind of subscription? Will they receive at certain time within the treatment process and all that? And we subjected this back to the patients, or so that we could get feedback on them. And my colleagues, those will take you through some of our feedback.
Okay, thank you, Daniel. So as Daniel said, that we went back to the Södertälje hospital with these ideas and interviewed the real patients and the nurses at the hospital. So as you can see on the screen, it's the quotes from the interviews, and we realized that the human contact is a very important thing, and also what to eat is a very big question. And the patient suggested that basic dimmed kit is actually better because it's very hard to define you as a traveler or like sporty person, because it can change. So in that way, that basic kit and additional item would be better. And this our star nurses suggested that we should also have the emergency number, also visual information for the people who actually cannot read. So with this interview feedback, we updated the prototype of the kit. So now the content of the kit is information in a different language and emergency number, and some information about the application and websites, which is useful. And as Daniel mentioned, there's a diabetic cookbook, and also there's some advice about when to eat that banana. So maybe finally you can get the answer about that. And also some diabetic foods and the sugar-free foods, and we also included something called personal note from the nurse. So it kind of addresses that issue of human contact. Yeah, so we had this idea, and then now my colleague will continue with the inspiration of the kit.
So we received inspiration from a wide range of trends and traditions around us. In the last few years, the unboxing phenomenon has exploded on the internet. It's basically YouTube videos of people unboxing, unpacking products that are sent to their homes. And the joy and excitement that's displayed in these videos that people watch are very impressive, even if it's something simple and practical, such as a kitchen appliance that are being unpacked. We definitely wanted to capture some of that joy in our solution. For the last 80 years, soon-to-be parents in Finland have received the baby box. It includes clothes, diapers, toys, and the box itself can also be used as a crib for the babies. Finland has the lowest infant mortality rate in the world, and we thought there was a lot of elements of the Finnish baby box that we can use, that we could reference and take inspiration from when we designed and developed our kit solution. So, why the kit? Our kit can't solve everything. It can't cure diabetes, and it might not even help our banana guy. But this is what, something similar to this is what diabetes patients receive today when they're diagnosed, a plastic bag with pamphlets in Swedish and a few other things. The solution that we are suggesting is not just the redesign of this plastic bag, but it's a thorough makeover of the content and the concept and the presentation of the initial starter kit. We looked at a similar initiative at Skaraborg sjukhus a few years ago that dealt with improving the self-care of diabetes patients. They calculated that they, when they succeeded, saved 93,000 kronor per patient in a year. This is also a communication tool between the hospital staff, the nurse, and the patient in the long term. It can be, you can go back to the kit, go over the content, see what works and what doesn't work, and help improving the lifestyle and adjust advice accordingly. We also believe that this kit could be a community building tool where the community at large and the private sector could get involved and contribute to the kit with products and discounts and samples. It would be great if this could have a domino effect within the hospital to other departments for other diagnoses, where they can get inspired to create specific kits for other diagnoses. If this works, it will be good PR for the hospital. And not least, and obviously most importantly, it will improve the quality of life of the patients and introduce a smile to the process that can be very challenging for someone just diagnosed with diabetes. This was our presentation. Thank you so much for listening. You can follow the arrows on the floor upstairs to come and see our exhibition. And if you have any questions, we're more than happy to answer them right now. Yeah.
So thank you so much. Any questions? Comments? What do you think? Wouldn't you be attracted by that box with a beautiful decoration up on it? Oh, good. Here is a comment.
Thank you so much for a really nice and clear presentation, and I really like your solution. I don't have a question, but just a comment, being the communications manager at Openlab. I really like the idea that you got inspired by the unboxing phenomenon, and I'm imagining also like a communications campaign of like filming and uploading when you unbox your diabetes kit, and also like sharing information about what it's like to living with diabetes. So well done, guys.
Thank you.
Thank you.
Yeah, I couldn't agree more. Well done. Do we have a comment from the challenge giver as well?
Very good job, and I really want to get started right now with this. I'm gonna figure out how to do the boxes like you did it.
And what about the AI nurse? You like the AI nurse, even though it's not presented here. Is that something that you could give us that as a challenge for next year even?
Because I think it's also some ethical issues that you have to make clear first, and how to document and everything like that. So it's maybe a bigger problem than I see it right now. Yes, but I think it's a really good idea. Yes.
Any more comments, questions? Yes.
Good morning.
Morning.
Thank you for a very good presentation. I would like to ask you about the group dynamics. You come from different cultures, different countries. How was it how did you take decisions, and how was the group dynamics?
Okay.
We had good group work. We worked really well together, I would say. We are a mixed group, but I think that's a good thing. We definitely had different perspectives and different experiences and different takes on the different solutions. So we had
Yeah, for example, when we finally chose the concept, the kits, we had quite a long negotiation between between the Diamond Center and the kids. So it was really like that we needed to like maturity, or like everyone needed to be on board before we took the decision. And I think that was the only time when we actually needed to spend more time. So usually we thought quite well alike, which is surprising, but nice that we were teamed up.
And I also think the fact that we come from different places helped, because Södertälje is the same, has like 50% people from different groups. So it helped knowing how that is like. For instance, if we were all Swedish, we probably couldn't know what is it like being from a different place. So that also helped thinking out of the Swedish box, for instance.
Thank you so much. Any more comments, or should we thank the group Diabetes Follow Up? Thank you so much.